Welcome to Tea Time with Dr. Sahar. Let me tell you the tea about what just happened in clinic the past couple months. So I had this patient, right? Let's call her Sue. She's 45 years old. She's a mother of two beautiful girls, has an amazing husband. And she came to me because she had chronic digestive issues. She was bloated. She had super loose stools. She had this really interesting thing where she had to run to the bathroom after every meal. Nobody could figure out what was wrong with her. She had gone to her doctor. They ran all the labs. Everything was normal. They couldn't figure out what exactly was going on. So she came to me, first visit's 90 minutes, right? So we did a full intake. And then we found out all of her symptoms began during her first pregnancy. Searched a little bit more and found out during pregnancy she had IV antibiotics for an infection she was having. There's a time and place for antibiotics. They were necessary at that time, but ever since those antibiotics, she started having these symptoms. So when it comes to antibiotics, they can mess up the gut microbiome. So you have to always come back if you notice symptoms after antibiotics to kind of heal up the damage. So she came to see me, and I started with her like I start with most of my patients. If you have digestive issues, this means there's a digestive disruption. Your body is so intelligent. In naturopathic medicine, the basic premise is that this body has an innate healing force. You see it anytime you get a paper cut, the body can heal itself even if you don't do anything else. That inner healing process is always at play. So I'm thinking about what is stopping that healing force in this patient right now. Why is she having diarrhea? Why is she having bloating? Why is she having bad smelling gas? Something is off. Instead of her just coming to me and I give her a little supplement and send her on her way so her bloating would stop, the more interesting question is, why are these symptoms happening in the first place? So I started her off with a food intolerance evaluation to figure out what her body's not digesting. Because, and if you don't remember anything else, remember this: if a body cannot digest a food, it ferments in your gut. And that fermentation process creates toxins that go into your bloodstream and affect tissues and organs, and it can affect everybody differently. It can affect you and your weakest link. It could affect someone's skin, someone else's lungs, someone else's mood. It shows up in different ways. So then, instead of us giving supplements or medications to treat the symptoms, we remove the thing that's creating a burden on your body's healing force. And so then everything works better. All of the supplements and medications we give work effectively and faster and last longer. Instead of just giving you a treatment for problems that are literally arising from what you're eating. So anyway, we do this dietary evaluation on her, and we find out that her results are eggs. And she was blown away because first of all, she had her own chicken coop. She would brag about this to like the other local moms, we're all organic, free range. And so, I mean, it's a little devastating. There's a lot of work that goes into having a chicken coop, and she's having her own eggs, and she thought it was a great source of protein and, all of the things. But the reality is, although eggs could be a generally healthy food, it wasn't healthy for her, and it was creating toxins for her. So we had to remove the egg. And then I gave her some herbal medicine and some supplements to heal her digestive support, heal her digestive lining. She had a lot of antibiotics in her life. And the question kind of is here, a lot of people have this kind of question. I've been fine my whole life. Why all of a sudden? Why after that one antibiotic I started having symptoms? And the way that I like to explain this is that it's like the final drop in the bucket. Your body is accumulating so many toxins and so many exposure all throughout your lifetime, and then it's the final drop in the bucket where then things start to overflow and you have symptoms. It's similar to old age. People think once we get older, we just start having health issues once we turn 60. These problems don't just come on at a certain birthday. The reality is it's the accumulation of exposures and wear and tear and toxins that eventually by the time you get old, you start showing symptoms. Same way with health. So the reality was we had to heal her digestive tract. In the first month, she started noticing her bloating went down. Within month 2, her stools started normalizing. Within month 3, she no longer had to run to the bathroom after every meal. Which by the way, that's stressful by itself. If after every meal you don't know how the food's going to make you feel, that can make you feel on edge and not safe in your own body. So what we did was we removed her dietary intolerance, cut out the eggs entirely, We gave her some digestive healing support, which included some herbal medicine and some homeopathics. And she was also experiencing a little bit of eczema on her heels, so I gave her a topical herbal cream. This patient had used her insurance to see a lot of different doctors within the conventional medicine system, and she didn't get the resolution of symptoms she was looking for. So that prompted her to seek out naturopathic medicine. It was actually her PCP, who was a colleague of mine, who referred her to me, where she was willing to pay out of pocket to go deeper. Because the first visit is 90 minutes, which is the average visit in the US is 18 minutes with your PCP. So when you don't get answers within that conventional model and you need to go a little bit deeper, then you pay out of pocket for this kind of visit. So that explains the kind of person who's a really good fit, who has insurance, who's really tried everything within their insurance model and didn't get an answer to their solutions, and now they want a deeper dive and they want to look under other rocks. I have this saying at my clinic wellness house where I say, I don't guess, I test. So the first category of labs is just your standard blood labs. You go to LabCorp, Quest, easy. Then there's a second category of tests that I call specialty testing. This is the deeper dive labs. These are the labs that your average PCP does not run. These include food intolerance testing, food sensitivity testing, looking at what foods your body can't digest or cause an immune system reaction. Then we have things like mold testing, seeing if your body actually has mold from being in a damp environment. Then we have things like the Dutch test, which is the gold standard for hormone analysis, really amazing for my menopausal women. And the fifth one is parasite testing, seeing if you picked up any bad actors, maybe in your travels, water supply, fecal oral contamination.